Morning class. So today we're going to be going over Chapter 40, Terrorism Response and Disaster Management. EMS operations, knowledge of operational roles and responsibilities to ensure patient, public, and personnel safety. Mass casualty incidents due to terrorism and disaster, risk and responsibilities of operating on the scene of a natural or man-made disaster. Introduction. You may be called on to respond to a terrorist event during your career. It is difficult to plan for and anticipate a response to many terrorist events. Several key principles apply to every response. What is terrorism? Terrorist forces have been at work since early civilizations. Terrorism involves violent acts or acts dangerous to human life that violate federal state law and appears to be intended to intimidate or coerce a civilian population, influence the policy of a government by intimidation or coercion, affect the conduct of a government by mass destruction, assassination, or kidnapping. International terrorism occurs primarily outside of the United States. Terrorism is common in the Middle East. Domestic terrorism occurs primarily within the United States. In the United States, domestic terrorists have struck multiple times. I'm sure you guys have heard recently about the Las Vegas shooting a couple years ago. We've had the 1994 Oklahoma bombing, or I believe that was 95, and then we had the Olympic bombing in 94 in Atlanta, and obviously 9/11, another domestic terrorism incident. Only a small percentage of groups actually turn to terrorism to achieve their goals. Religious extremist groups, doomsday cults, may participate in apocalyptic violence. Extremist political groups include violent separatist groups and those who seek political, religious, economic, and social freedom. Cyber terrorists, those who attack a population's technological infrastructure. Single issue groups include anti-abortion groups, animal rights groups, anarchists, racists, and eco-terrorists. Weapons of mass destruction, also called weapons of mass casualty, any agent designed to bring about mass death, casualties, massive damage to property and infrastructure. B-Nice and CBRNE are mnemonics for the kind of WMDs. B-Nice, Biologic, Nuclear, Incendiary, Chemical, and Explosive are going to be your different types of weapons used normally in mass destruction incidents. CBRNE, Chemical, Biologic, Radiologic, Nuclear, and Explosive. Explosives have been the preferred WMD. Chemical agents consist of vesicants, blister agents, respiratory agents, choking agents, nerve agents, metabolic agents, cyanides. Biologic terrorism warfare. Biologic agents are organisms that cause disease. The primary types are viruses, bacteria, and toxins. Nuclear radiologic terrorism, only two publicly known incidents, Hiroshima and Nagasaki. So nuclear bombings back in World War II, those are the only two documented times that a nuclear bomb was ever used. Hopefully it will never happen again. These materials are far easier for determined terrorists to acquire and require less expertise to use. Dirty bombs can cause widespread panic. EMT response to terrorism, the basic foundations of patient care remain the same. However, treatment can and will vary. Always remember situational awareness. Recognizing a terrorist event, planning of acts of terror is covert. You must know the current threat level issued by the Department of Homeland Security. National Terrorism Advisory System. Alerts from the NTAS contain a summary of the threat and actions that first responders, government agencies, and the public can take to maintain safety. On every call, you must make the following observations: type of location, type of call, and number of patients. Victim statements, pre-incident indicators. Response action, scene safety. Stage your vehicle a safe distance away. Wait for law enforcement personnel. If you have any doubt, do not enter. Best location for staging is upwind and uphill from every incident. So remember, that's going to be your test question too. Also in NREMT, where are you going to park for pretty much any situation? You always want to park uphill and upwind. Secondary device, additional explosives set to explode after the initial bomb. So we have a probably gas tanker right here. It's flipped over, and you see it's got some fluids leaking too. A possible hazmat incident, depending on what kind of fluids in here. So we've gone over MSDS, or Material Safety Data Sheets. Usually in the cab is where you're going to have those MSDS sheets to tell the first responders what exactly is in here. And then you're also going to have some placards. It's kind of hard to tell, but there's a little diamond shape right here, and there should be a placard in there to tell you the hazards associated with whatever's in here. Responder safety. The best form of protection is preventing yourself from coming in contact with the agent. Contamination occurs when you have direct contact with the WMD. Cross-contamination occurs when you come in contact with a contaminated person. So this is why we always stage in the cold zone. We don't do the decontaminating. That happens in the warm zone. We want to make sure that patient is decontaminated, hopefully fully, before you get that patient. Because if that patient's still contaminated and you bring them to a hospital, you're going to contaminate everyone inside that hospital. Notification procedures. Notify the dispatcher of the nature of the event, any additional resources that may be required, the estimated number of patients, the upwind or optimal route of approach. Establish a staging area. Trained responders and PPE are the only persons equipped to handle the WMD incident. Establishing command. You may need to establish command until additional personnel arrive. You and your other EMTs may function as medical branch directors, triage, treatment, or transportation supervisors, logistics officers, command and general staff. Reassessing scene safety. It is every EMT's responsibility to constantly assess and reassess the scene for safety. This is an important component of situational awareness. Chemical agents, liquids or gases that are dispersed to kill or injure. Persistent non-volatile agents can remain on a surface for long periods. Non-persistent volatile agents evaporate rapidly. Route of exposure is a term used to describe how the agent most effectively enters the body. Agents with a vapor hazard enter through the respiratory tract in the form of vapors. Agents with a contact hazard or skin hazard give off very little vapor or no vapors and enter the body through the skin. Vesicants, primary route is the skin contact. If vesicants are left on the skin long enough, they produce vapors that can enter the respiratory tract. Cause burn-like blisters to form on the victim's skin and in the respiratory tract. Usually cause the most damage to damp or moist areas of the body. Signs of vesicant exposure on the skin: skin irritation, burning and reddening, immediate intense skin pain, formation of large blisters, gray discoloration of skin, swollen and closed or irritated eyes, permanent eye injury including blindness. Sulfur mustard, brownish yellowish oily substance, generally considered very persistent, begins an irreversible process of damage to the cells, attacks vulnerable cells with the bone marrow, and depletes the body's ability to reproduce white blood cells. Sulfur mustard vapors can be inhaled, creating upper and lower airway compromise. Leucid and Vosgen oxim produce blister wounds very similar to those caused by mustard, produce immediate intense pain and discomfort when the contact is made. The patient may have a grayish discoloration at the contaminated site. Vesicant agent treatment. No antidotes for mustard or CX exposure. Ensure that the patient has been decontaminated before treatment is initiated. If the agent has been inhaled, the patient may require prompt airway support. Initiate transport as soon as possible. Generally, burn centers are best equipped to handle the wounds and infections. Pulmonary agents, gases that cause immediate harm to persons exposed to them. The primary route is through the respiratory tract. Once inside the lungs, they damage the lungs. The lung tissue and fluid leaks into the lungs. Pulmonary edema develops, resulting in difficulty breathing because of severely impaired gas exchange. Chlorine, the first chemical agent ever used in warfare, initially produces upper airway irritation and choking sensation. Patient may later experience shortness of breath, chest tightness, hoarseness and stridor, gasping and coughing, pulmonary edema. Phosgen, product of combustion, a very potent agent with a delayed onset of symptoms. Initially, a mild exposure may include nausea, chest tightness, severe cough, dyspnea on exertion, pulmonary edema. Pulmonary agent treatment, remove the patient from the contaminated atmosphere, manage the ABCs aggressively, pay particular attention to oxygenation, ventilation, and suctioning. Do not allow the patient to be active. There are no antidotes. Consider requesting ALS. Nerve agents, among the most deadly chemicals developed, can cause cardiac arrest within seconds to minutes of exposure. G agents from the early nerve agents, the G series. So we have different types of nerve agents, and then the odor. I'm sure you guys have heard at least sarin gas. It's pretty high on the volatility level. So nerve agents all produce similar symptoms but have varying routes of entry. Use sledgem and dumbbells. So these, remember this mnemonic, so this will tell you the different types of symptoms once somebody's exposed. So sledgem, salivation, sweating, lacrimation or excessive tearing, urination, defecation, drooling, diarrhea, gastric upset and cramps, emesis, muscle twitching or meiosis. So nerve agent treatment, duodo, auto-injector, antidote treatment, nerve agent, auto-injector. So metabolic agents, hydrogen cyanide and cyanogen chloride are both agents that affect the body's ability to use oxygen, commonly found in industrial settings, associated with dizziness, lightheadedness, headache, and vomiting. High doses will produce shortness of breath, gasping respirations, respiratory distress or arrest, tachypnea, flushed skin, tachycardia, alter mental status, seizures, coma, apnea, cardiac arrest. Cyanide agent treatment, all the patient's clothes must be removed to prevent off-gassing in the ambulance. Support the patient's ABCs, initiate transport immediately if antidote by ALS is not available. So remember, try and get all that chemical stuff off the patient's clothes, and also take all those patient's clothes off, put it in a bio bag, and then cover the patient up. Worry about their ABCs because that's going to be the most important care that you're going to have for this patient. And then transport immediately. It's going to be a code 3 transport to the hospital because there's not much you guys could do as EMTs to treat this patient if they have been exposed to a nerve agent. So biologic agents can be almost completely undetectable. Diseases caused will be similar to other minor illnesses. May be spread in various ways. Dissemination is the means by which a terrorist will spread the agent. A disease vector is an animal that spreads disease to another animal. How easily the disease is able to spread from one human to another human is called communicability. Incubation is the period of time between the person becoming exposed to the agent and the appearance of the first symptoms. So I think they go in a little further description and explanation of communicability and incubation period. You guys should know that too. Communicability. This also talks about like the different routes of how a disease gets spread. So you guys should know the different routes that certain diseases can be spread and how to protect yourself from that. Incubation period is basically the time that you're exposed to the time that you actually start to show symptoms. So if you get exposed to someone who has pneumonia or a cold, usually it takes maybe a couple days, and then that's when you first start showing symptoms. So you might have an incubation period for pneumonia, 3 to 5 days. Different diseases have either shorter or longer incubation periods. Viruses, germs that require a living host to multiply and survive, invades healthy cells and replicates itself to spread through the host, moves from host to host by direct methods or through vectors. Smallpox is highly contagious. You must wear examination gloves, a HEPA-filtered respiratory, and eye protection. Observe the size, shape, and location of the lesions. Characteristics of smallpox. So communicability. You get it from infected patients or contaminated items such as blankets, pillows. Person-to-person transmission is also possible, and then the route of entry. So how does it get into the body? How do you guys get exposed to it and possibly transfer the diseases over to yourself? It's got to be inhaled by cough droplets or even direct skin contact with blisters. So know how you're going to get exposed. Know how that disease get transferred over. That way you guys protect yourself out in the field. Viral hemorrhagic fever causes the blood in the body to seep out from the tissue and blood vessels. The patient will have flu-like symptoms, progressing to more serious symptoms such as internal and external hemorrhaging. All standard precautions must be taken. So you guys should go over this one too. Your dissemination, communicability, route of entry, signs, symptoms, and medical management. Bacteria do not require a host to multiply and live, more complex than viruses and can grow up to 100 times larger. Most can be fought with antibiotics. Most will generally begin with flu-like symptoms. Inhalation and cutaneous anthrax. Anthrax is caused by a deadly bacterium that lays dormant in a spore. Routes of entry are inhalation, cutaneous, and gastrointestinal. Pulmonary anthrax is the most deadly. Antibiotics can be used to treat anthrax successfully. Okay. And then you guys can go over that too. Plague. Natural vectors are rodents and fleas. Bubonic plague infects the lymphatic system and creates buboes. Pneumonic plague is a lung infection that results from inhalation of plague bacteria. Here are just some pictures of some of the symptoms. I doubt that you guys would run into the bubonic plague during your career. So neurotoxins, most deadly substances known to humans produced from plants, marine animals, molds, and bacteria. Route of entry is ingestion, inhalation, or injection. Not contagious and have a faster onset of symptoms. Botulin toxin, most potent neurotoxin produced by bacteria. Affects the nervous system's ability to function. Voluntary muscle control diminishes. Eventually, the toxin causes muscle paralysis, leading to respiratory arrest. Ricin, derived from mash from the castor bean, causes pulmonary edema and respiratory and circulatory failure, leading to death. Quite stable and extremely toxic. Treatment is supportive and includes both respiratory support and cardiovascular support as needed. Other EMT roles, syndromic surveillance, monitoring patients presenting to EDs and alternative care facilities. Patients with signs and symptoms that resemble influenza are important. Quality assurance and dispatch need to be aware of an unusual number of calls from patients with unexplainable symptom clusters. Points of distribution, established in the time of need for the mass distribution of antibiotics, antidotes, vaccinations, and other medications and supplies. Pushpacks distributed by the Centers for Disease Control and Prevention Strategic National Stockpile. Pushpacks have a delivery time of 12 hours anywhere in the country. Radiologic and nuclear devices. Ionizing radiation is emitted in the form of rays or particles, alpha, beta, and gamma, or X-ray and neutron radiation. Alpha is the least harmful type, beta is slightly more penetrating. Gamma rays are faster and stronger. Neutron particles are the most powerful. Okay. So, a picture here, and your book explains it a little bit. Alpha can be simply blocked by most things. Betas can be blocked by patient's clothes. Gamma is going to go through a patient's clothes, so you guys are going to need certain type of vest or gowns to block out that gamma radiation, and neutron's just going to go through walls, so you're going to have a specific room to block all that stuff out. Once radiologic material has been used, the remaining material is called radiologic waste. These materials can be found at hospitals and healthcare facilities with radiology departments, colleges and universities, nuclear power plants, chemical and industrial sites. Radiologic dispersal devices. Any container designed to disperse radioactive material. A dirty bomb can injure victims with a radioactive or explosive material. The dirty bomb is an ineffective WMD. Nuclear energy is artificially made by altering or splitting radioactive atoms. The result is an immense amount of energy that usually takes the form of heat. Nuclear material is used in medicine, weapons, naval vessels, and power plants. Nuclear weapons kept only in secure facilities. The likelihood of a nuclear attack is extremely remote. The whereabouts of many small nuclear devices are unknown. Special atomic demolition munition. Patients exposed to excessive radiation are considered victims of acute radiation toxicity. Effects of radiation exposure will vary depending on the amount of radiation and the route of entry. Radiation can be introduced into the body by all routes of entry. And then your common signs and symptoms: radiation toxicity, low exposure, moderate exposure, and severe exposure. Being exposed to radiation source does not make a patient contaminated or radioactive. However, when patients have a radioactive source on their body, they must be initially cared for by a hazmat responder. After decontamination, you may begin treatment with the ABCs. Wear appropriate PPE and place all body fluids in containers for proper disposal. There's no protective gear designed to completely shield you from radiation. The less time that you are exposed to the source, the less the effects will be. Make certain that responders are stationed far enough from the incident. Always assume it is the strongest form of radiation and use concrete shielding. Incendiary and explosive devices. Incendiary are used to start fires, and explosive devices come in various shapes and sizes. It is important to identify an object you believe is a potential device. Notify the authorities and safely evacuate the area. Always remember that there is a possibility of a secondary device when you respond to the scene. Primary blast injury. We've gone over this. Primary, secondary, and tertiary. Primary direct effects of the pressure wave on the body, seen almost exclusively on the hollow organs. An injury to the lungs causes the greatest morbidity and mortality. Secondary blast injury, penetrating or non-penetrating injury that results from flying debris. Tertiary blast injury, whole body displacement and subsequent impact with environmental objects. Also includes crush injury, quaternary blast injury, any other injury caused by a blast. The physics of an explosion: when a substance is detonated, a solid or liquid is chemically converted into gas under high pressure. This generates a spherical blast wave. Flying debris and high winds commonly cause conventional blunt and penetrating trauma. Hollow organs such as the middle ear, lung, and GI tract are most susceptible to pressure changes. The ear is the organ system most sensitive to blast injuries. Primary pulmonary blast injuries occur as contusions and hemorrhages. Blast lung is the most common cause of death from a blast injury. Neurologic injuries and head trauma are also common causes of death from blast injuries. Extremity injuries, including traumatic amputations, are common. So what type of terrorist group would most likely bomb an abortion clinic? Remember the different types of terrorist groups? So A, single issue terrorist groups, as their name implies, focus on single issues. They include anti-abortion groups, animal rights groups, anarchists, racists, or even eco-terrorists who threaten violence as a means to protect the environment. The term weaponization is defined as C, weaponization is the creation of a weapon from a biologic agent generally found in nature that causes disease. The agent is cultivated, synthesized, and or mutated to maximize the target population's exposure to the agent. The Department of Homeland Security posts a daily advisory system to keep the public aware of the current terrorist threat level. What does an orange level indicate? I don't think we've gone over it in this presentation, but it should be in your book. Different types of level. So B, according to the Department of Homeland Security advisory system, the color orange indicates a high risk of terrorist attacks. Red, the highest level, indicates a severe risk of terrorist attacks. Yellow, elevated, indicates a significant risk of terrorist attacks. Blue, guarded, indicates a general risk of terrorist attacks. Green indicates a low risk of terrorist attacks. You're dispatched to a bombing along with 15 other ambulances. Upon arriving at the scene, you should stage your ambulance. We've said this multiple times. This should be on your test. You guys should have already seen this. This should be on your EMT as well. So B, as with any hazmat incident, you should stage your ambulance uphill and upwind from a bombing site. A hazardous chemical may have been released during the bombing. Remaining uphill and upwind from the incident site will minimize your risk of exposure. A terrorist would most likely use a secondary explosive device. So D, a secondary explosive device is usually aimed at injuring or killing rescue workers. It is also designed to be caught on camera by the media, which draws public attention to the terrorists. Biologic or chemical agents can be dispersed by the primary device, secondary device, or both. When assessing a patient who is exposed to a vesicant agent, you should expect to encounter So A, the primary exposure route of vesicant agents, also called blister agents, is the skin. Vesicants usually cause the most damage to damp or moist areas of the body, such as armpits, groin, and respiratory tract. Signs of vesicant exposure on the skin include irritation, reddening, and burning, immediate intense pain, and the formation of large blisters, among others. What does sulfur mustard do to the cells within the body? So C, sulfur mustard or Agent H causes the cells to mutate, which changes the structure of the cell, so it can no longer perform its functions within the body. This causes cellular death, which can lead to end organ failure. Pinpoint pupils, vomiting, bradycardia, and excessive salivation are signs of exposure to So B, Soman, a GD, is a nerve agent and can cause death within seconds to minutes of exposure. The mnemonic dumbbells can help you recall the signs and symptoms of nerve agent exposure. Stands for diarrhea, urination, meiosis, bradycardia, and bronchospasms, emesis, lacrimation, and salivation, seizures, and sweating. You respond to a plastic factory where numerous people present with shortness of breath, flushed skin, and altered mental status. One of the patients tells you he smells almonds before he started feeling sick. These people were most likely exposed to this might be another test question you might see somewhere. Smelling almonds is a common sign of what kind? So C, cyanide is a colorless gas that has an odor of almonds. It is produced in many different industries in the United States, such as plastic processing, gold and silver mines, and photographic studios. You should never suspect a chemical exposure whenever multiple patients present with the same or similar symptoms. Factors that have the greatest impact on severity of radiation exposure include So D, the best way to protect yourself from the effects of radiation is to use time, distance, and shielding. Radiation has a cumulative effect. The less time you are exposed, the less effects will be. Radiation is also limited how far it can travel. Depending on the type of radiation, moving only a few feet may be enough to remove you from immediate danger. The path of all radiation can be stopped by a specific object. Alpha rays can be stopped by a newspaper. Beta rays can be stopped by your clothing. Gamma rays by several feet of concrete.